Hi, and welcome back to Hey Doc, What's Up? This is another part of our series of hormone imbalance or estrogen dominance and the trouble that that can get us into. So last time what we talked about was fibroids, the micro tears of the smooth muscle of the uterus that cause an obstruction and that are stimulated to grow by estradiol or estrogen. They can cause trouble in pregnancy. They can cause trouble with your periods. They can just cause trouble because they're causing a uterus to enlarge in an enclosed space. So what else can happen is endometriosis. Now, this is a very kind of unusual concept for a lot of people to grasp and get their heads wrapped around. But think of when you have a period and you have this lining in your uterus, and all of this lining needs to come out and land on a tampon or a pad. Well, imagine if you have flow that doesn't just go what we call antegrade and come forward and out the cervix onto a pad or a tampon. What if it goes retrograde and it goes back through the tubes and lands either on your ovaries, on the tubes themselves, or in your pelvis? Well, there are not just pieces of blood, but little pieces of tissue of that lining that are being pushed back out through the tubes that are coming out and landing in the pelvis. If those little pieces of tissue land next to blood supply, those pieces of tissue are then stimulated to implant, like lining implants on a uterine wall, and it will be stimulated to grow during your next cycle and then bleed in your pelvis with your next period. So that means all of your bleeding isn't just coming out and landing on a tampon or pad where you see it. Some of it is landing where you don't see it, but you feel it. And you feel it with intense, deep pelvic cramping. What if it goes on for longer than it should? Well, many doctors will actually suggest that you have some sort of laparoscopy or a way to take a look inside of your pelvis to find out if that's what's happening. Will an ultrasound or a CT scan or an MRI help you find this? Not until it gets big enough for more than the naked eye to see. Remember, the naked eye can see a lot. You can see the tiny, clear little bleb of what the beginning of inflammation of that lining is that's now growing is going to show us. When you start bleeding into that bleb, it's going to look bright red. As darker blood sits in there mixed with bright red, it's going to look darker, like a dark brown, and it can almost look like what's called a cigarette burn. So when you see a cigarette burn in a pelvis, that can only mean one thing, and that's past bleeding, and it is 99 times out of 100 endometriosis. Endometriosis by itself is painful, but it will cause the body to try to soothe it. So it will contract and scar where it is implanted, but your fat pad in your abdomen, your omentum, will come over and it will try to cover it up and soothe it, but then it gets stuck. So that means that your bowel will also be less mobile because it also is attached to your omentum. So think of it as having poured super glue into your pelvis and the after effects of everything getting pulled in into that super glue environment. When a doctor goes in to make the diagnosis, they may not even see cigarette burns anymore. They may simply see a mass of things stuck together, and trying to pull apart things that have been super glued together, as you can imagine, is not an easy task. Thank goodness you're asleep for it. But when you wake up, you have to deal with the aftermath of what they had to do to try to peel it apart. Could it even mean that once you peel it apart, that you now have raw surface area, that once you're out of the operating room, those raw surface areas may repeat glom together again because you still have endometriosis or that retrograde flow happening all over again. So endometriosis is hormonally managed just like ovarian cysts are hormonally managed, just like fibroids are hormonally managed. These are all things many women end up in an operating room for, but it doesn't mean that that's your only answer. And it doesn't mean birth control pills are your only answer. Bioidentical hormones can easily manage these issues and get your hormones back in balance. It will simply take noticing that you have these issues going on, confirming you have these issues going on, and then dealing with managing your hormone levels. Next time, we'll talk about breast health on Hey Doc, What's Up?